Vietnam, a developing nation, with a sizable population of 97 million people, that has a large land border with China, hasn't reported even a single death from coronavirus. In this video, we'll consider why this is the case. But first, how would you like an ongoing collection of essential news, helpful resources and 100% free reports about Vietnam, dating and marrying of Vietnamese women? Too easy. Just take a quick moment to subscribe. And click the bell icon. And I promise, you'll never miss out again. As of April 21st, Vietnam had reported a total of 268 cases of COVID-19, with more than 140 people making a full recovery. The big question many people are asking is, how in the world have Vietnam managed to avoid the nightmare that so many other nations are facing? According to experts, the reason why Vietnam has managed to keep patients from death's door is down to a unique three-pronged government strategy. And while the approach may seem harsh when it comes to upholding civil liberties, they are proving essential to keeping the pandemic at bay. Step number 1. Temperature screening and testing. Starting in February, anyone arriving at an airport in a major Vietnamese city had to go through compulsory body temperature screening, and fill in a health self-declaration, stating their contact details and travel and health history. These measures are now mandatory for everyone entering major cities, no exceptions. They were required in some provinces by land too, and for literally everyone entering a government building or hospital. Anyone with a body temperature of over 38 degrees is taken to the nearest medical facility for more thorough testing. Those who are proven to have lied in their self-declaration, or who resist declaring altogether, can be criminally charged. Businesses including banks, restaurants and apartment complexes have also implemented their own screening procedures. There has also been intensive testing across the entire country. Testing stations have been set up across cities, which all citizens can attend. Communities who live near confirmed cases, sometimes an entire street or village, are swiftly tested and placed in lockdown. By March 5, Vietnam had validated 3 different test kits, each costing less than $25 and producing results within 90 minutes. These are all being manufactured in Vietnam. The cost of testing matters everywhere, but is particularly important in emerging economies like Vietnam. And these affordable test kits have helped the government's intensive testing strategy. Step number 2. Targeted lockdowns. The second prong of Vietnam's approach is quarantine and lockdowns. Since mid-February, Vietnamese people returning home from abroad have been quarantined for 14 days on arrival and tested for COVID-19. The same quarantine policy has been applied to all foreigners coming to Vietnam. Anyone who has come into direct contact with an infected person, the details of who are publicized, is encouraged to come forward for quarantine. If it's discovered somebody has come into contact with someone who has tested positive, they will be put into mandatory quarantine. In March, Vietnam started to lock down whole cities and specific areas in a city. Traveling between cities is now highly restricted. For example, in Da Nang in central Vietnam, anyone who is not a registered resident of the city but wishes to enter has to submit to a 14-day quarantine at a government-approved facility which they must finance themselves. Villages of 10,000 people have been fenced off on account of single cases. Bach Mai, a famous hospital of 3,200 people in Hanoi, which is also a leading COVID-19 treatment center, was even locked down in late March after one externally contracted staff member tested positive. Businesses, both state and private, are closed down, and the tourism and airline industries are essentially frozen. Step number 3. Constant communications. From early January, the Vietnamese government has been in constant communication to citizens about the seriousness of the coronavirus. Because communications have been clear, fake news has been avoided. The people of Vietnam understand that COVID-19 is not just a bad flu, but something to be taken extremely seriously. So people are advised not to put themselves or others at risk. The government has been creative in its communications methods. Each day, different parts of the Vietnamese government, from the Prime Minister, to the Ministry of Health, to the Ministry of Information and Communications and provincial governments, text citizens with information. Details on symptoms and protection measures are communicated via text to mobile phones all over the country. The government has also partnered with social media messaging platforms, such as Zalo, to distribute updates. This is coupled with propaganda art across the country, and newly designed stamps, that further disseminate public health messages about the virus. Cities throughout Vietnam are adorned with colorful and eye-catching posters that remind citizens of their role in stopping the spread of the virus. At the same time, the government is revealing details of those who have COVID-19 or, in rare cases, have escaped quarantine, though the person's name is not made public. Even if some cases have not yet been detected by officials, there's no doubt that the unique Vietnamese approach has been effective in reducing the spread of the virus. These combined measures mean Vietnam has not yet experienced any large-scale community outbreak, which could otherwise devastate a city like Ho Chi Minh City with a population of 11 million and overwhelm the country's public healthcare system. The three prongs of Vietnam's strategy may not please everybody, but they are working. They are saving lives and avoiding a national disaster. The Vietnamese healthcare system has the time to treat each patient, and in so doing, keep the number of COVID-19 deaths at zero. Vietnam has so very much to teach the world as COVID-19 is set to spread further across developing countries. Thanks for watching. You could have been anywhere in the world. But you're here. And we appreciate that more than we can say.